limb and their associated movements, let's take a look at some of the muscles we saw today from a clinical perspective. We learnt earlier about the rotator cuff muscle group and how these four muscles were important in rotating and stabilizing the shoulder. If you are a gym buff or frequently play sports, you're probably familiar with the term rotator cuff injury. There are three main types of rotator cuff injuries: tendinitis, bursitis, and strains. Today we're going to be focusing on strains. A rotator cuff strain occurs when the tendons of the rotator cuff muscles become overstretched or torn. Symptoms of the rotator cuff strain include pain on lifting or rotating the arm, swelling around the shoulder, and shoulder joint stiffness. Strains are usually caused by overuse of the rotator cuff or may occur from acute trauma to the shoulder joint. Treatment of a rotator cuff sprain includes rest, ice, and non-steroidal anti-inflammatory drugs to reduce inflammation. Strengthening exercises may also be used to restore active function and strength to the tendon. On complete rupture of the tendon, surgical intervention may be necessary. Daily shoulder stretches can aid in increasing flexibility and strength of the shoulder joint. When stretching, it is important to strengthen the muscles around the shoulder blade and posterior shoulder specifically to optimize the muscle balance of the rotator cuff. We did it! We made it to the end! Before we finish up though, I'm going to quickly summarize what we learnt today. We started today's tutorial by looking at the main muscles of the shoulder. We learnt about the large deltoid muscle and the rotator cuff muscles, which include the supraspinatus and infraspinatus, the teres minor, and the subscapularis muscles. Finally, we identified the teres major muscle. We explored how these muscles assist in creating movements of abduction, adduction, and internal and external rotation of the arm at the shoulder. We then moved distally to the arm. The main muscles of the arm were grouped into anterior and posterior groups. Muscles of the anterior group consisted of the biceps brachii, the coracobrachialis, and brachialis muscles. We identified the anterior group to be predominantly flexors of the arm and forearm. The main muscle of the posterior region was the triceps brachii muscle, and we learnt that its main function was extension. The forearm came next. The main superficial muscles of the anterior forearm that we had a look at today included the pronator teres, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, and the flexor digitorum superficialis muscles. The main muscles of the deep anterior forearm included the flexor pollicis longus, the flexor digitorum profundus, and the pronator quadratus muscles. Muscles of the superficial and deep compartment of the anterior forearm were seen to be predominantly flexors of the forearm, hand, and fingers. Then we met the superficial and deep posterior forearm muscles. Some of the main superficial muscles of the posterior forearm included the brachioradialis muscle, the extensor carpi radialis longus muscle, the extensor digitorum, and the extensor carpi ulnaris. The main muscles of the deep posterior forearm include the extensor pollicis longus muscle, the extensor indicis, and the supinator muscle. We learnt that the main action of the posterior muscles of the forearm was to extend the forearm, hand, and fingers. Finally, we came to the hand. We grouped all those little muscles into 5 separate groups and explored how each group created fine motor movements of the hand. We divided the muscles of the hand into the dorsal interossei, the palmar interossei, the lumbricals, the hypothenar muscle group, and the thenar muscle group. We learned that the muscles of the hypothenar group included the abductor digiti minimi, the flexor digiti minimi, the opponens digiti minimi, and the palmaris brevis muscles. The thenar muscle group included the abductor pollicis brevis, the adductor pollicis, the flexor pollicis brevis, and the opponens pollicis muscles. Once we looked at all the main muscles of the upper limb and their associated actions, we then had a quick look at some clinical notes on rotator cuff injury.